81. A 12-month-old should be able to walk independently. True or false? Answer: true. Rationale: by 12 months, most infants walk independently, reflecting gross motor development per infant developmental milestones. 82. Choking hazards are not a concern for school-age children. True or false? Answer: false. Rationale: school-age children remain at risk for choking on small objects or foods, requiring supervision and education per pediatric safety guidelines. 83. The polio vaccine is administered orally to infants. True or false? Answer: false. Rationale: the inactivated polio vaccine, IPV, is given intramuscularly, not orally, starting at 2 months per CDC immunization schedules. 84. A temperature of 37.0 degrees Celsius is considered febrile in a neonate. True or false? Answer: false. Rationale: a neonate's normal temperature is 36.5 to 37.5 degrees Celsius. Fever is defined as 38 degrees Celsius or higher, requiring evaluation per pediatric vital sign norms. 85. Guided imagery is an effective pain management strategy for school-age children. True or false? Answer: true. Rationale: guided imagery engages school-age children's imagination, reducing pain perception per pediatric pain management guidelines. 86. Poison control information is unnecessary for homes with toddlers. True or false? Answer: false. Rationale: toddlers are at high risk for accidental poisoning, requiring parents to have poison control contact information per pediatric safety guidelines. 87. The stepping reflex in neonates persists until 12 months. True or false? Answer: false. Rationale: the stepping reflex disappears by 2 to 3 months, with persistent reflexes indicating neurological concerns per neonatal developmental milestones. 88. Adolescents require the same nutritional needs as younger children. True or false? Answer: false. Rationale: adolescents have increased nutritional needs, e.g., calcium, protein, due to growth spurts differing from younger children per pediatric nutrition guidelines. 89. Non-pharmacologic pain management is ineffective for neonates. True or false? Answer: false. Rationale: non-pharmacologic methods, like swaddling or sucrose, effectively reduce pain in neonates during procedures per pediatric pain management guidelines. 90. Nurses must report all parental discipline methods to authorities. True or false? Answer: false. Rationale: only suspected abuse or neglect requires reporting. Routine discipline methods do not, per legal and ethical pediatric standards. 91. A 3-year-old should be able to name at least 3 colors. True or false? Answer: true. Rationale: by age 3, children typically can name 3 or more colors, reflecting cognitive development per preschool developmental milestones. 92. Rice cereal is the only safe first food for infants. True or false? Answer: false. Rationale: infants can start with various single-grain cereals or pureed foods, e.g., vegetables, at 6 months, not only rice cereal, per pediatric nutrition guidelines. 93. The influenza vaccine is recommended annually for children over 6 months. True or false? Answer: true. Rationale: the influenza vaccine is recommended yearly for children over 6 months to prevent flu complications per CDC immunization schedules. 94. A pulse rate of 60 beats per minute is normal for a sleeping toddler. True or false? Answer: false. Rationale: a toddler's normal pulse rate is 80 to 130 beats per minute, even during sleep. 60 beats per minute indicates bradycardia, per pediatric vital sign norms. 95. Family-centered care includes providing emotional support to parents. True or false? Answer: true. Rationale: supporting parents emotionally reduces stress and enhances their ability to care for the child, per family-centered care principles. 96. Bicycle helmets are optional for adolescents. True or false? Answer: false. Rationale: bicycle helmets are mandatory for adolescents to prevent head injuries, per pediatric safety guidelines. 97. Neonates should receive their first bath immediately after birth. True or false? Answer: false. Rationale: delaying the first bath for 6 to 24 hours maintains thermoregulation and skin integrity in neonates, per neonatal care protocols. 98. Adolescents should be screened for substance abuse during routine visits. True or false? Answer: true. Rationale: screening for substance abuse identifies risky behaviors early, allowing for intervention, per American Academy of Pediatrics guidelines. 99. Oral medications are always safe for children under 2 years. True or false? Answer: false. Rationale: oral medications require careful dosing and may be contraindicated in young children due to choking risks or metabolism, per pediatric pharmacology principles. 100. Nurses should respect cultural preferences in pediatric care planning. True or false? Answer: true. Rationale: respecting cultural preferences ensures family-centered, culturally competent care, improving outcomes, per pediatric nursing standards. 101. A 6-year-old should be able to read simple sentences. True or false? Answer: true. Rationale: by age 6, school-age children typically can read simple sentences, reflecting cognitive and language development, per developmental milestones. 102. Infants should receive cow's milk as a primary beverage at 9 months. True or false? Answer: false. Rationale: infants should not receive cow's milk until 12 months due to inadequate nutrients and potential gastrointestinal issues, per American Academy of Pediatrics guidelines. 103. The Haemophilus influenza type B, HIB, vaccine reduces the risk of epiglottitis. True or false? Answer: true. Rationale: the HIB vaccine prevents infections caused by Haemophilus influenza type B, including epiglottitis, administered starting at 2 months, per CDC immunization schedules. 104. A normal respiratory rate for a 12-year-old is 30 to 40 breaths per minute. True or false? Answer: false. Rationale: a 12-year-old's normal respiratory rate is 16 to 20 breaths per minute at rest, similar to adults, per pediatric vital sign norms. 105. The nurse should use a car seat with a 5-point harness for a toddler. True or false? Answer: true. Rationale: a 5-point harness provides optimal safety for toddlers in car seats, securing the shoulders, hips, and pelvis, per American Academy of Pediatrics safety guidelines. 106. The APGAR score is used to assess long-term developmental outcomes. True or false? Answer: false. Rationale: the APGAR score assesses a neonate's immediate post-birth condition, not long-term development, which requires other tools, per neonatal assessment protocols. 107. Adolescents should be offered private consultations during health visits. True or false? Answer: true. Rationale: private consultations respect adolescent autonomy and encourage open discussion of sensitive issues, per American Academy of Pediatrics guidelines. 108. Antipyretics are unnecessary for fevers below 38.5 degrees Celsius in children. True or false? Answer: true. Rationale: fevers below 38.5 degrees Celsius are typically monitored without antipyretics unless the child is uncomfortable, per pediatric fever management guidelines. 109. The FACES pain scale revised is appropriate for assessing pain in 4-year-olds. True or false? Answer: true. Rationale: the FACES pain scale revised is suitable for children as young as 4 who can interpret facial expressions, per pediatric pain assessment guidelines. 110. Medications can be administered to a child based solely on parental verbal orders. True or false? Answer: false. Rationale: medications require a written provider order or verification, not just parental verbal orders, to ensure safety, per pediatric medication administration standards. 111. A 9-month-old should be able to wave bye-bye. True or false? Answer: true. Rationale: by 9 months, infants typically develop social gestures like waving bye-bye, reflecting fine motor and social development, per infant developmental milestones. 112. Fruit juice should be limited to 8 ounces daily, for preschoolers. True or false? Answer: true. Rationale. The American Academy of Pediatrics recommends limiting fruit juice to 4 to 6 ounces daily for preschoolers to prevent obesity and dental issues. 113. The HPV vaccine is administered to prevent hepatitis B infections. True or false? Answer: false. Rationale. The HPV vaccine prevents human papillomavirus infections, not hepatitis B, which has a separate vaccine per CDC immunization schedules. 114. A heart rate of 100 beats per minute is normal for a 3-year-old at rest. True or false? Answer: true. Rationale. A 3-year-old's normal heart rate is 80 to 130 beats per minute at rest, with 100 being within the typical range, per pediatric vital sign norms. 115. Family-centered care includes providing resources for parental education. True or false? Answer: true. Rationale. Providing educational resources empowers parents to participate in their child's care, a key aspect of family-centered care per pediatric nursing principles. 116. Pool fences are unnecessary for homes with school-age children. True or false? Answer: false. Rationale. Pool fences prevent drowning in school-age children, who may access pools unsupervised, per pediatric safety guidelines. 117. The sucking reflex in neonates disappears by 12 months. True or false? Answer: true. Rationale. The sucking reflex, essential for feeding, typically fades by 12 months as voluntary feeding develops, per neonatal developmental milestones. 118. Adolescents require the same caloric intake as adults. True or false? Answer: false. Rationale. Adolescents have higher caloric needs than adults due to growth spurts, varying by activity level and gender, per pediatric nutrition guidelines. 119. Sucrose solution is an effective pain relief method for neonates during procedures. True or false? Answer: true. Rationale. Sucrose solution reduces pain perception in neonates during procedures like heel sticks, per pediatric pain management guidelines. 120. Nurses can share a child's vaccination status with schools without consent. True or false? Answer: false. Rationale. Sharing vaccination status requires parental consent under HIPAA, except in specific public health mandates, per legal standards.